Thanks for staying with us. So joining us on the show to discuss the medical brain drain in Nigeria and how the country can ultimately revive its ailing health sector is Dr. Malvis Humphrey. He is a biomedical science specialist and a mental health, nursing, public health, and business management specialist. Welcome to the show, sir.
Thank you.
Good to have you.
Thank you.
Right, so you're qualified in the UK and you're an experienced healthcare management consultant. And you're somebody who obviously have worked in the health sector for a while in the United Kingdom. You came back to Nigeria to also start up your business, trying to get the name here. Yes, so you started that in Nigeria. And one of the reasons why I wanted to have you on the show is to share experience of there and here. Because we have lots of Nigerians who relocate to America, to the UK, and they're doing so well. I mean, it's unbelievable the amount of expertise we lose. As an experienced health medical expert, I'd like you to give us, to compare and contrast your experience in UK and in Nigeria, and what can we do to make it better and to reduce the brain drain we experience on a daily basis.
Thank you so much for bringing me on the show. I'm going to be speaking from the perspective of a healthcare professional and a healthcare entrepreneur, both in the UK and in Nigeria. I'm fortunate to own a healthcare establishment in the UK. I own care homes and nursing homes. And over 90% of the people I employ are actually Africans. And one of the things I've been doing over the past years is to actually do a bit of survey as to why. Why is there a lot of influx of nurses, doctors from developing world, Nigeria being one of my case studies, obviously, because I'm from Nigeria. And looking at how do we support to limit that brain drain. One of the first things I've been able to come across was regulation. In the UK, we have a well-regulated healthcare system. We have a body called the Care Quality Commission, which all healthcare providers, wherever you are, hospital, I've been a hospital director before as well, hospital, wherever you are, you have to be registered with the CQC. And the CQC, Care Quality Commission, regulates everything up to your staff, workforce, the quality of healthcare. So every healthcare provider have a level of service they have to provide, which gives everyone working there satisfaction and even give the patient a bit of confidence in the service that they receive. Then coming to Nigeria, so my question was, do we have the same regulatory system that make healthcare something that the patient and even the people there are proud of? And that's one area where the country is actually failing. We don't have an effective and a healthcare system that is well implemented, that is actually creating that quality of care that the patient and also the staff working there need. I've been fortunate enough to work with a lot of state government, and that's one project we're currently working on, trying to set up a regulatory system that's actually effective. Because one thing you should realize is, if a doctor, for instance, in the UK is not getting the right level of satisfaction from job, not treated rightly, they report to the CQC straight away. And what happened immediately, CQC then automatically could strike out that company because they are not meeting up to the standard they should. Wow. So that way, automatically, you living in a system where you know the workers are actually still owners of the business because they can get you off if you are not meeting up to standards or to some certain levels of criteria.
But doctors are usually paid. Go ahead, man.
Okay, I was just going to say, for Nigeria, it's about, most times, it's just about how much they get paid.
Okay.
So this organization that makes sure that everyone gets the satisfaction from their jobs, does it also determine how much they are paid? And is that what we're lacking here?
Okay, another thing is living wage. You know, the UK have a system where people are paid by minimum wage living wage. And again, living wage is basically a calculation of those the income you need to make your basic needs. The problem we have here really is not people talk about you earn so much. I have a lot of friends, people have doctors working for me and nurses. If you look at what they pay there, you make a lot of conversions. You look at if somebody was actually earning a living wage here, look at the quality of life. Actually, living in Africa, you have a better quality of life. That's something I always argue with people because you are able to get involved in things that actually you could have a lot of, for instance, the type of food that you eat. There's a lot of organic food here, which give you a better lifespan and all that. But the problem we have in Nigeria is the workers here, the healthcare professionals here, are not getting living wage payments. You go into a hospital, for instance, you ask the nurse how much are they paid. You realize the nurse could be earning 30,000 naira, 40,000 naira, which is not enough for them to live. I'm not saying you have to pay a nurse $1 million naira, for instance, because the government or the healthcare provider might not be able to meet up to it, but a living wage. In the UK, a nurse might be earning £2,000 a month. Ask the nurse at the end of the month how much is left on your savings. You realize they don't have a lot left. But the question is, they're able to use what they are earning to have a good quality of life.
Yeah, but you see, you get money usually through the insurance companies. I mean, there's a system that pays the doctors. So, I mean, I've worked in for an insurance, a health insurance company back in the US, and I know where doctors have to send us their bills. You know, so we pay them. So it's not like, so in Nigeria, a lot of hospitals have private businesses. I can only pay you what I earn. And many, in fact, some hospitals don't even like going through the through this insurance company, because many of them they don't get paid properly. They like the private clients, because those ones will pay you and you can actually pay your staff. But we don't have a very functional healthcare system such that the health insurance adequately pay our doctors. That's an issue. But do you really believe the Ministry of Health is not doing enough? Because if you ask the Ministry of Health, they'll say, listen, we are helping to fund. We're doing all we can do, but we're not an insurance company. We can't pay the salaries of these doctors. It's a business. The doctors should pay their nurses.
Yeah, like you said, the Ministry of Health is not doing enough. The reason why I say that is I've fortunate to have quite a lot of friends who work in ministry. The question is, the funding is there. But the problem is, when you don't have a system that regulates processes, fundings will be misused.
Right.
That's true. The funding is there. The finances are there. They are there because I'm fortunate to get involved in some projects. But the problem is, when you don't have a system that regulates, if the funding will be wasted and it will be channeled in the right course, and then what then happens is there is not enough to create that living wage and quality of life expectation for the people that are working there. Every system has its funding process. The US have an insurance scheme, for instance. In the UK, we have the government. The government kind of highly funds care, penitentiaries, free services, and all that. And there are people who still private pay when they feel they need to obviously pay themselves. But the problem here is the fundings that we have here in our healthcare system. The government here, apart from even the IGR they generate, they get international fundings, even to support with our healthcare here.
So,
but the question is not well.
Okay, let's go to the part of Jackpot. Those are living. What can we do not to live? Yeah, go ahead.
So, in my own opinion, I feel that people have a right to pursue a better quality of life.
Yeah.
However, because I'm residing here, I worry about medical emergencies and who will be left in the hospital to take care of us that were in Nigeria. How do you believe the government can handle the massive brain drain we're experiencing? What would you say from your interaction with medical personnel on ground can be the right incentive to keep them here? Okay.
I'm not always against people leaving. I left Nigeria, and that was why I became a better professional. And I've also had friends who left and came back to reinvest the skills that they've got overseas here. And the only reason why I'm still here is because I have an enabling environment. So what I mean is I've been able to meet people who created an environment that is allowing me to function. So at the end of the day, first of all, the doctors and nurses that are leaving, in as much someone is not getting enough to have a good quality of life, you can't stop them. Yeah, first of all, what we need to look at is what policies do we need to have in place, at least to make the wages of a doctor, to be able to give them a quality of life, a living wage. They're not asking for too much. So if the government can have a system that makes, not just saying 30,000 is minimum wage, but have a living wage that is tied to these professionals, then that's something.
Maybe I'm not clear. Help me understand a living wage. So a living wage is a figure that is connected to every single thing you need. So your house, your car.
At least enabling you to meet your basic needs.
Yeah. Gotcha.
Now I need you to meet your basic. If I can meet my basic needs, trust me, if we can just get that right, helping these healthcare professionals meet their basic needs.
So it's not like, so for example, if my living wage could be 2 million naira a month, for example, so the 2 million might not come to me, but that 2 million naira, we've got you your house. So we'll deduct the money for the house. We've got you your car to live. We've got you some various expenses. So the money might not come to you. At the end of the day, you might not have anything, but at least that 2 million we know is towards something to make you live.
Have something to have quality of life.
Right, gotcha.
Because when we are able to create that quality of life, forget about what people say, you go here, UK, I've been there, you earn £10,000 a month. It's always about what's left. I have doctors who are here, and they have better holidays than people who are overseas because they can save. They can travel. They can. They don't pay bills. They don't pay. There are some things that you can save on here.
Well, we should pay taxes because that's why they can pay.
What I mean by tax.
That's why you can pay living wages because somebody's paying tax. Yeah, we can't do that because they're not paying tax.
The thing is, like for instance, you drive your car sometimes in the UK to go into central London, you pay £50. So there are some things here that we can save on and you develop for that takes all this penny out. But
that's the problem for us because we are telling Nigerians to pay for ordinary to buy electricity. They increase tariff is why they carry placard. Ordinary, no, you're saying any little thing. To remove subsidy so you can pay fuel in market prices, you carry placard. It's the same thing.
When they are paid.
It's the same thing.
For what they are getting.
They are not getting it.
You won't get it if you don't pay it. Yes or no? No, answer. I want
Listen. I don't mind paying tax.
Yeah.
If you
don't mind, but
listen.
Yeah, Waba.
Let me
This
finish.
what that guy died. Idris Waba, was it?
Let me finish.
The NLC guy doesn't want to pay tax.
Let me finish. If he lives in the UK
About Kiari,
and he's paying tax,
Yeah.
when he retires,
Yes.
that tax, they will use it to look after him, so
Yes.
he doesn't have to work.
Yes.
Even as a private citizen, not government employee, here is only government employee that gets pension. If I'm going to pay tax, what is it for me? What is in it for me at the end, towards the end of my life, when I'm 60, when I'm 70, when I'm 80, and I cannot work again?
Yeah.
There is nothing. So I've just paid tax, forgot, and then some government people will just do the tax as they like. Let there be a system where those who pay tax get pension. Let there be a system where people will see the benefit of the tax that they are paying.
Okay. So I don't want us to divert the conversation.
Yes,
But in Lagos State tried to get us taxes. Remember, and I always when during Ashwaju's time, where the federal government did not give federal allocation, he now started looking for internally generated revenue. He got money. We now started establishing LASMA. We got street lights over the place. We started seeing what the IGI he was generating. We saw it. But can't you use that same format and say, okay, let us do this on the federal level? No. Ali Uwaba will carry placard and say, don't increase taxes. Don't increase this. How would you get anything? If Lagos State has used a template that works, can't we therefore replicate it? I mean, we've seen it work in Lagos.
Yeah,
anyway, let's not change it because we can always let's go back to brain drain.
So,
sorry.
Another thing we need to look at is what are those income? There are some things we can't stop. Now we can't stop the brain drain. So what do we do? If we are able to create a system that creates more employment opportunities for our healthcare professionals to earn income in a different way, even while not living in the country, then that's another area where we can reduce how much these people live. So one of the projects we started to get involved in, we are training healthcare professionals who get involved in consultancy, even on the technical direction, telemedicine, where people don't have to leave the country, but they could be consulting for people outside of the country. I have medical professionals who have started to do content writing while they are here in Nigeria and earning in pounds.
Yeah.
And I've had people who have started to mentor to become healthcare consultants, where they can, because sometimes you need international companies who actually want to go into developing world, and they need someone who can do a bit of survey statistics. So the country needs to start looking at how do we, if we can't afford and make these people rich, how do we create opportunities to make them to be more skilled, to be able to do things.
That's like having the best of both worlds. So you're in Nigeria, and you're not paying the taxes they're paying there, but at least you are earning
You're
pounds.
able to get that. You're able to get that. So and if we start looking at that direction, so the doctors, I've got a few doctors and nurses who are already working in that direction. I run a company that is into healthcare, that train people on to become healthcare assistants.
But no, okay, go ahead.
I want to quickly just throw in this question because I like the way you said that you came and you met people that gave you sort of like an enabling environment. Because many people watching, we have lots of diasporan viewers who would like to have that, come back home and do something with the knowledge they've acquired over there. Yeah. What would you say is the state level? What has the response been? Because we hear the negatives. We don't hear this positives one that you'll get to that. How has that been? Coming back, who gave you that enabled environment? And how would you encourage people watching right now that would want to come back home to add value? Okay,
I think being in the, I was fortunate to be sometime a commissioner in the UK in the borough in health and the healthcare manager. So what I used to do then was I invested in bringing commissioners to the UK. Not the government didn't pay for it, I paid for it because I had the passion. I was looking at how can healthcare improve in Nigeria. I funded healthcare professionals, policymakers to come to the UK, have a forum where we discuss what their problem was. And me coming back to them, I've never one day gone to a state and said, my first impression was not come and let's start talking about contract. I was looking at how can I give to you. I've given more than state can give to their citizens, even to some states. We just did a project where we gave close to 100 million worth of medical equipment free to a state. So we're coming with intervention. So after a while, when they started seeing that it's not just the norm, it's about improvement of process. So then at the end of the day, it becomes crazy when somebody brings solutions to you, but you not then align them with your needs.
Sorry, Miriam. Is there a group of Nigerian medical doctors in the UK where you guys come together and have a formidable force, like towards or are you all just individually doing one by one? You come home, you go home, you do this. Can we all have all of you come together under an organization and say, okay, this is the direction? Is there anything like that in the UK?
There is a group. The doctors have group, nurses have group, every professional have group. But in as much those ones are doing their things in their different way. But when it comes to meeting some key agendas, when it comes to group and agendas, there are two different things. There's always a direction for a group. And then when you have an agenda that you want to meet, for instance, there are times when going in a group might actually slow down that process. Not because you can't achieve it as a bigger group, but because sometimes a lot of bureaucratic process and all that. So we have groups that are coming together to do things. But most of the time, some of us that have actually created more remarkable impact have been those that are doing very specific agendas.
Yeah. So I'll come to you, Mariam, now. So because we've seen the Indian format, the Chinese format, they go as a group. They don't individually. They actually come together, and that's how they're able to create communities internationally and try to give back. But you know what? We understand the politics of the whole thing. Yes,
yes.
Mariam.
So you just started to mention training, and I wanted to find out what you think. A lot of people say, oh, our Nigerian medical personnel are so well trained in Nigeria, and they go abroad and they do so well. But here we constantly talk about all sorts of mismanagement, mistakes. Is it the system that's the problem, and thereby making our medical practitioners complacent? Or is it the lack of that organization that you say helps to maintain a standard, even though we have a medical organization that helps to maintain standards within our Nigerian hospitals? What is it that they are doing differently there that makes our Nigerian medical practitioners do so well over there?
When they get there?
Yes.
I think the first thing is I've had doctors that came to my practice, and the first week they came, I had to make nurses mentor them. Not because they were not academically sound, but they don't understand a lot of medical ethics. So the thing there that's different is being a doctor that qualified 20 years ago, a nurse that qualified last year might know more than you because there are latest ways of doing things. But the problem that is here is how has continuous professional development like?
Exactly.
I have a PhD in infection control, but every year I still have to sit down and get someone train me who might just have a BSc on infection control, on what is happening in infection control, because it's a requirement that I need to show that I've done infection control training every year, even when I have a PhD in it. So that's the same thing. So we have mandatory courses that every healthcare professional must do. So there are some of them that I can close my eye and train, but I still have to sit down every year to keep my license because I have to show the government I've attended it. Safeguarding training, health and safety. So what systems are we implementing here? That a doctor does not, you don't have a choice. You have to do this training every year just to make sure that you are things might have changed. Updating yourself on a regular basis. So that's something we also lack here in the country.
Interesting.
So, yeah, that's something that we like here.
I'll let you go because I know the ladies like to what we discussed it, but this is quite. Let's get a few messages from.
Well, let me say one more thing. So I have a mom who worked in a nurse most of her life and has just retired about a year ago. She has so much experience, and she's had to work with Nigerians in diaspora that come into Nigeria. They come as a group to give all forms of free medical services, and she's worked with them. And I feel like now that she's retired, so all that experience, all that skill, who can use her? I mean, who can make use of the skills that she has now, and how would it impact our health sector now? Is she a good candidate for a health sector, and how would she impact it positively?
Yeah, she is. Experience, they say you can't buy. The experience you've gathered over years. So we have a lot of mentorship programs that we're in the UK, for instance, which we're also creating here. I have some direct work with the Nursing and Midwifery Council. The registrar is a very good friend. So we'll be looking at creating system and practice, how we can improve nursing practice in the country. Such people, for instance, who are that have had the experience and all that, there are so many things ethically they've learned, experience they've learned, incidents that they've seen that they can share even with the new people who are newly qualified. Yeah. I think it's just about identifying themselves to a group or to an organization or even to a hospital who has that same goal and vision. Right. Like we do, for instance. We have a lot of nurses on our board who are high-level nurses.
Just on a lighter note, there was a Catholic hospital that is in Maryland that my kids took their immunization from, and the matron there was a retired matron from the regular government. She has finished in the government hospital at tenure, and then she now volunteers at time in a Catholic hospital, and she was amazing.
There's always a difference, you can tell.
It's different. She was wonderful with the kids. But I wanted to ask you, because over and over again, it seemed like we know what the problem in Nigeria is. Systems. We need to have systems. When we strengthen the system, everything works well. Yeah. And for us to have that system, we need to have policies and people follow through with the right policies. I went to the US, I want to become a realtor. I must do training every month as a realtor to show that I'm compliant. How do we implement the right system? Like, can we leave government and focus on every state creating a medical blueprint, and how can that pan out?
Yeah. So, like what you said, every state needs to create their regulatory system. We're currently helping a state now mirror CQC in the UK. The state have given order upon and went in there, brought CQC policies. I did a revamp of their health system, visited all their hospitals. Now they're actually passing through the House of Assembly to have a regulatory system that regulates healthcare in the state. That's where we need to start
Checking all the private hospitals.
Yeah, and there are some states who have something that looks like it, but it's not yet there. So what we then look at is, okay, it's something they want, they had an idea, but we then go in there, strengthen it, make them have a better understanding. But majority of the states don't even have this. If you don't have that, you can't expect quality where there's no regulation.
Can I read this tweet from Festus Akimbo Yewa? He says, FG can't fix our health sector without taking the difficult decisions about how to fund it. UK government just raised taxes and national insurance to tackle the crisis in the health sector. Even pensioners will now pay taxes for the first time in the UK. He says FG must stop all subsidies, stop spending billions of naira to train doctors. Tuition fees for medical students in the UK is averagely £36,000 per year. Then they will be able to invest effectively in the health services and pay doctors
so
well.
Nigerian, that even buttresses the point, because Nigerians, we train the best doctors in this part of the best doctors in the world. They go to University of Nigerian universities, and they travel abroad, and they're the stars. But their counterparts abroad are still paying back loans, £40,000. But you get a very, very subsidized education. You go abroad, you earn the big salaries, and you don't have to pay anybody's
that is one of the problems that we have here. We subsidize the education.
We subsidize fuel. Subsidize everything.
Subsidize
processing. We subsidize health. Everything.
Education. I didn't talk about fuel. We subsidize education. And then you cannot afford to continue. Yes. You know, so I think all those things.
So there was a time that it was like yes. They had free education, everybody traveled abroad, they come back, free education here, free this. But we can't afford that anymore.
We even had free scholarship abroad, and then they will go abroad with government funding their education abroad, and they don't come back.
Yes, we can't do that anymore.
The country was mismanaged.
Yeah. Yes,
from the get-go.
It's still being mismanaged.
I know, we know that one.
I was a pastor. I think what you're doing is fantastic, and I only wish you the best. I was a pastor at church again this weekend. I guess I'll be going to that church more often now, because ordinarily a lot of things I got from the sermon. He was talking about the fact that he went to the UK. His wife was sick at the time, and he was told that, listen, for you to get this woman, we have to go and see a special doctor. So I can't remember the neighborhood. You put it on silent. The neighborhood was supposed to be in. They told him to go in for £30,000. And he had to just gather the money. And he got there. They were all waiting for this big doctor. He was waiting for this white man to show up. And just saw this guy in jeans and T-shirt, an Indian on the side, a Malaysian on the side. Where is the doctor I'm waiting for? And it happened to be this smallish-looking guy. So the guy started checking his wife. What is this guy checking? This guy waiting for weeks to get an appointment. And guess what? He asked, Uncle, what's your name? He said, I'm Emeka. He said he just froze. Uncle, which university goes to? University of Nsukka. And this is a doctor that was highly revered. Yeah. That they were waiting for to see his wife. So the point is that we have the best. That's the truth. And you're one of our products that are traveled abroad.
We're proud of you. We're proud in
you. We like that you're coming back, but I will still advocate that all of you, Dr. Emeka's, all of you like that in America, form a group. Yeah. Have an agenda. have a 10-point agenda. Okay, we're going to put X amount of millions of dollars together. We're going to do this. We're going to invest this. We're going to come back to train and get this, your CQ, whatever it is, in particular states. Have a plan. You can't do it individually.
Yeah.
Only one state. We need a group.
Some states will listen to you because you don't speak their language. Probably the states will listen to.
The truth matter is Nigeria is a very funny country.
It is. It is.
That's the first question. It's not about coming as a group that gives you. It's about who are you. It's not what I mean. So
who you know?
We know.
So if you know you're going to get, you rather try to get success where you know you get success rather than fighting against a brick wall. So because we can only do the best we can. But honestly, like you said, we've got the best medical professionals in Nigeria. Yeah. And there are things that can still happen to make people stay. Absolutely. But just that we're not looking at them squarely and also implementing on the right.
I mean, the guest we brought, was it yesterday? The presidential candidate.
Yeah.
Oh, yeah,
he was saying that when his friends were talking to him, he said, listen, when they was asking, what would you want me to do if I become president? He said, just hands off.
Leave us.
Just leave us. Let the private sector just do this thing. Leave up. Your job as governor, as federal government, just a facility. Make sure that there are roads. Make sure there's electricity. Make sure the basic. Leave us to work. If it's medical, we'll sort it out. If it's health, everything will sort it out. But you know what? We'll get there someday. That's how we conclude. Better. Every conversation in Nigeria, we say,
but it will, because little by little, he's having impact. It might not go all around.
Of course.
But eventually, some Edo State education, Lagos State education, there's impact. You know, there little by little we're churning.
Thank you very much. Any final words we have to wrap up, sir?
Just to kind of say again that healthcare, we will get there at some point. And the truth of the matter is, like she said, taking it one region by region.
Yes.
We can't solve our problem. Even the UK still have problem.
Yes.
That's just the truth. America everywhere has problem with healthcare, which we can't solve in just one. Everyone keep improving. But we just have to have faith in what we're doing.
Yes, so thank you. I hear that. YK was making a comment saying that, she was reading saying that pensioners are going to be having tax. She said it very calmly. The pensioners will be starting to pay tax
for the first time.
If it was Nigeria, she would carry tax. Hey, pensioners.
Excuse me.
They are calling for taxes.
Are you going to tax pensioners that you are not giving money? They are taxing the pensioners from the money that they are giving them. What are you saying?
Pensioners does not pay for transport services in the UK.
Did you remember? Remember Funke Akindele's? Have you paid your? There was a real campaign in Lagos State, LIRS there. Have you paid your tax?
I am not against paying tax. Don't even go that way.
No.
I am not against paying tax.
You and Ali, I don't want us to pay tax.
I am saying if I'm paying tax,
I want to see.
Let me see what when I'm 80, what did I pay tax for?
Yeah, we'll see. Let's just see.
At least you should have free healthcare.
At least in the list.
That is all we can take on the show. Thank you very much, Dr. Valde. It's a pleasure having you.
Somebody driving
YK,
big cow, doing big wedding for his daughter.
Have a lovely day. We'll see you tomorrow.
Thank you.
I pay more than you.